Hi rehabbers, and this week the learning is on how to read a cervical spine MRI in 5 minutes or less, a basic step-by-step guide for complete beginners. So the aims are to identify the relevant anatomy of the cervical spine and to identify the more common pathologies. The first thing we need to look at is the different slices. So we've got the sagittal, where you're basically split into bits like this. And then we've got the axial, where you're split like that. And then we have the different signals. So T1, fat is brighter compared to T2. And the water and fluid is darker on T1 compared to T2. And when we're looking at the MRI, so I use the ABC approach. So we have alignment. So we're looking at the vertebrae. B is for the bones, the vertebrae signals, the disc signals. C is for cord. And then I add in the ligaments, so the anterior longitudinal ligament in blue, the posterior longitudinal ligament in pink, and the ligamentum flavum in yellow. So that's his basic anatomy very quickly. So now we look at what they look like when it's not normal. So we have some disc bulges, degenerative disc disease, some foraminal stenosis, some myelopathy. So with the disc bulges, so you can see here, so you've got your cord, and then you've got your disc bulges there. The degenerative disc disease, so you can see a more normal signal intensity there, but higher up it's lower in keeping with degenerative disc disease. With the stenosis, we then look at, so this is normal, so there's the cord and there's the foramen. As it starts to increase with stenosis, you can see it becomes narrower and then narrower still, and you can see from the picture representation what it starts to look like. We then start looking at the cord and we're looking for changes. So we're looking for, do they have this higher signal, which can be faint and diffuse, can be sharper and more low focal. It can be a mixture, but you do see the changes. This is the axial view of the same changes. So you can see the cord is normal. And then here you start to see that the signal is changing and there's more of a hyper intense look. Really important when you're looking at the myelopathies, you start to look as well at things like the posterior longitudinal ligament. So that's normal on the left, and on the right you start to see the thickening and ossification, which can start to narrow the space for the cord. You also look on the axial slices, so you can see a normal ligamentum flavum, and then you can see clearly a thicker one, which will then start to cause narrowing and can affect the actual cord itself. So in conclusion, following this very quick video, you should be comfortable in identifying the cervical MRI basic components using an ABC approach. So we've got your alignment, we've got bone, so you're looking for the signal in the vertebrae, signal in the discs. You've got C for cord. You're then looking as well at the ligaments, so the anterior longitudinal, the posterior longitudinal, the ligamentum flavum, because the last two are or can play a part in myelopathy. We know how to look for foraminal stenosis and narrowing on the axial views. So hopefully you found this useful, and if you have, please like and subscribe and tell everyone else about the videos. Until next time, bye.